note before we start, you can find all links and resources discussed in the video description, and please use them to support us. Please also comment, share your opinions and ask any questions. Thank you and enjoy.
Hello guys, I'm Abhishek. I'm the president of SAS, and I'll be hosting your webinar with Dr. Sheen Razdan for the roadmap from Poland to UK. For any questions, just write your questions in the comment box and we'll get to it at the end of the webinar or maybe during the webinar as well. Right, thank you.
All right. Hi, everyone. As Abhishek said, I'm a doctor here in the UK. I graduated last year from GOMED, though it feels like it's already been a very long time. So I'm currently in my third rotation of my first year. So I'm assuming everybody or most of the people here are studying in Poland at the moment. And what I can see from the answers of the poll, it's largely people in the fifth year and below. So I have a bit of mix of one, how to get in, and then how it is once we're in the UK. So to start with, your absolute Bible for looking at information of how to get in and what the process is this website, which is foundationprogram.nhs.uk. This is the official website, and this has multiple guides with timelines and all the information about what you need to do. They are quite receptive to emails as well. I can't remember how quickly they respond, but it's within a few days to everybody, which is, I think in our year, it was 9,000 people who joined the program. And everybody I know who asked a question got a response pretty quickly. So you should definitely check the website out. Then what is the foundation program? So the foundation program is a 2-year program that people who have just graduated from med school get into in the UK. In the first year, you get what is known as a provisional registration. So you are able to prescribe and everything, but you don't have a full registration. The main 3 kinds of programs are the standard 2-year one, which is what I'm doing. The specialized one is a sort of academic foundation program. So it's people who want to get into research or academia, and they have a slightly different way of having their 2 years. They either have one full block, which is 4 months dedicated to teaching, or they have a few days in a week throughout the 2 years, which are for teaching. And these tend to be in, you have to look up the different school. It's a foundation school, so it's a different region. And they have X number of spots and dedicated to different sort of academia and research fields. The priority program is for people who want to do certain rotations. It's like gynae, psych, respiratory medicine, and these are in rural areas or in under-serviced areas. And they have sort of incentives for people to go there because, for example, you can get 50% of your tuition for a postgraduate degree or something called a PG cert, which is a sort of shorter, less hands-on postgraduate degree that they have over here. And then this is only for people who have not done any kind of internship after med school. There is another thing which is called F2 standalone, which, for example, in Poland, if you've done your stage, then you can do after that. The basic timeline of applying to UK would be, so July would mean July of your 5th year. When you so as a non-UK graduate, we have to be eligible to apply to the process. So for us, it starts a little earlier. Everybody else starts in September. So in July, you have an eligibility application. My next slide goes further into what that is. In August, they confirm that you are eligible. However, you have to keep an eye out for changes that happen in your year, because I was looking at it today to see how it was when I had versus when I had applied, because it's now nearly 2 years ago. They've made some changes to the things that you need. Then in September, that's when everybody formally starts their application. And this is for everybody, people doing the specialized one, the regular 2-year one, or the priority one. And you start your application. It's on a website called Orel, which is what in the UK they use for everything, whether it's foundation program or specialty training and everything else. So it's a completely online form, and you have to upload certain things that they ask you for. Then I'll go further into what foundation schools are. So in the UK, geographically, it's divided into 18 regions, and each region is known as a foundation school or a deanery. And within the deanery, you have multiple hospitals or trusts, as they refer to, which are for certain cities, or sometimes one trust will be responsible for a few counties in the area. You're meant to rank the foundation schools. And then in March, you get allocated to a specific foundation school. Then you have to, within the foundation school, as I mentioned, you have trusts. So you get to know what we call jobs, which are rotations that you have. So you rotate every 4 months for 2 years. So it's 3 rotations in the first year and 3 rotations in your second year. So when you are on OREL, after you know which deanery or foundation school you're going to, you get a massive, it's very daunting. I should have put up a picture of what mine looked like. I only ranked about 100 sort of combinations. So you have multiple combinations of, for example, for me, I started, my first rotation was geriatrics. My second rotation was vascular surgery. I'm currently on ED. And then it's multiple combinations for your first and second year like that. And you're meant to rank all of it however you want. And now they've changed the process slightly. When I had done this, it mattered what your ranking was within your med school. And you had to give a sort of social exam online, which was called situational judgment test. So that was a little bit of a soft skills exam, not a clinical exam. However, this year they've trialed a new thing, which is called a preference informed allocation. And essentially everybody who's applying for this is given a randomly generated number, and you get a ranking based on that. And they've done some analysis, and they say that this ensures more people tend to get their top choices. I know some people who've gotten their top choices. I know some people who've gotten dead last choices. And unfortunately, as the process is entirely random, you have no control over it. Okay, I'm just looking at my notes for what else I had to say. And each foundation school, when this process sort of begins and you know where you've matched, people come out with these different Facebook groups and WhatsApp groups. And even prior to knowing when the process begins, I found it very helpful to be on different groups, because then even if I felt like, oh, I haven't done something, or there's a deadline coming up and I don't know, it's really helpful to have a sort of community of people doing the same thing, going through the same process. So you know that you're on track with everything and you've not missed anything. And you have a group of people to ask questions to if you're confused about anything else. Then in May, you start the process of applying for your provisional registration. So the body that gives you your provisional and final registration here is known as the General Medical Council, the GMC. So in May, you start the process for that. And you don't have your diploma in May when you're in Poland. So for us, you start the process. And then once you get your diploma, you're meant to, because we're not from the UK, we have to sort of get it, I can't think of the word, but just that it is indeed real. It's similar to the American process. There's a website called Epic, and it's quite expensive to have to do all this, but you have to sort of upload it and they verify it with your university. And then in July, everything is done and you know where you're going. The reference window, the reason I mentioned here, I remember now, is when you're doing the application, you're meant to choose somebody from your med school who's known you as a reference. And I picked somebody well in the year before, in September, because I knew that by the time the actual application sent them the form for the reference, it would be multiple people would be sending it to the same people. So make sure I ask somebody and some professor or teacher who knows you personally to fill that in. It's basically just to say that you've been thorough and things like that, nothing like very specific. Then this is the eligibility application that you have to allow you to apply to the foundation program process. So proof of ID is quite self-explanatory. Dean statement, I was reading today, has slightly changed, and now there used to be a sort of template and they had to get a stamp from the dean and things like that. Now I believe it's just going to be a letter. However, in Poland and probably everywhere else, these offices are quite slow with doing these things. So I would suggest you get these things done as soon as possible. And like I said, if you make a group, sometimes what we would do is, because we knew, I think for us, there were about 10, 15 of us applying to the UK. We tend to do these things collectively so that it would be easier for the dean's office as well, and for us, so that, there was more pressure on them to do it. Medical degree, obviously at this point, you don't have a degree as yet when you're doing the eligibility, because this is in your 5th year. You can again just get a letter from your medical school that you will get a diploma, or there is a template for that. I don't remember what the details were. PLAB, obviously, because we're EU graduates, we don't need to give. Prior to Brexit, if you were not a EU citizen, we would have had to do that. But post-Brexit, we don't need this. English language proficiency. Now, this is something that tripped up quite a few people. Even if you think that you're fluent, don't take this too casually. I gave the IELTS, and don't do as I say, not as I did. But I only studied the exam like 5 days prior, and I gave it very close to the deadline for the eligibility process. And fortunately, I was fine. But you're meant to get 7.5 in each section of the IELTS, which is reading, writing, speaking, and listening. And I know multiple people who are quite fluent, and some people who even speak English as their first language, who had to give it multiple times in order to get 7.5 in the writing section. There are a lot of free resources out there. I know some people even paid people to sort of read the writing section and give them advice on how to make it better. I found a website called IELTS Liz, which I thought was absolutely brilliant. And if you just sort of, even if you're good at writing, they expect you to just follow a very specific format. There's 2 sections of the writing. So I think one of the sections, which was the shorter writing section, I think I'd just done exactly how they expected it. So I managed to get the 7.5 in my first attempt, and I didn't have to do it again. But I know people who've given it 3 to 4 times. So plan this well in advance. Your IELTS score, I believe, is valid for 2 years. And I was reading something today about how now earlier you could not just improve in one section. So for example, if you didn't get the 7.5 in the writing, you can't just give the writing. But I believe that might have changed now. But always best to check when you're applying what the new changes are. Right to work. This refers to your visa and sponsorship. Obviously, again, this is 5th year, so you don't have this. So this is an option in the form that you need to choose, which is I will need to be sponsored or something along the lines of that. Clinical assessment, I had to check what this was today, but does not apply to those of us freshly graduating. This is for people who've had about a 2-year break between graduation and working. However, I know some people whose hospital that they eventually worked at had them do like a small version of an OSCE or something like that. I don't know if they could have failed that, or it's just something that they just had to do. I'm trying to remember what website this form was on. This is on the foundation program website that I mentioned in the first slide. And this has all this. It's also a very good website just to go through. They have very nice guides with pictures and how to fill the form in specific sections and everything. Then we have the GMC. So because I'm assuming everybody here is Poland or EU, we have a different sort of application process compared to people who are not from the EU. And this also, I think we start, I'm trying to remember what month we did it in. I graduated in July, and I think I needed to have my diploma in order to finish most of this. So try and get your diploma as soon as possible. For our university, some of us managed to get the diploma prior to graduation, so we could start this. And it's very important that it has to be the English version. I don't know about other universities, but Gdansk gives you a Polish and an English version, and people weren't expecting it, but on graduation, they gave us the Polish versions. So people who didn't already get the English versions had to wait, and that sort of delayed the process even further. So by the time you graduate, you obviously know exactly where you're going. So it's really stressful, having to wait, and then you're just dependent on the GMC and EPIC, which is the verification body, to sort of finish the process for you. So like I said, try and get it done really soon. The moment you've done your last oral exam or your last written, for us, oral was the last, internal medicine was the last exam you had to do. We instantly started asking them, when can we get our diploma, that we need it as soon as possible. Because like I mentioned, EPIC has to verify it. Their process of verification is also dependent on the university. And there was some confusion at our university. We didn't know who was the person who had to. Someone just asked, will this presentation be available? Yeah, I'll send it to Abhishek, and there will be a recording as well. We didn't know who was the person who was meant to verify the degree for EPIC. but then eventually found out. But yeah, like I said, best is ask people who've gone through the process, because sometimes the dean's office people don't know, they've changed and things like that. So to save yourself the headache, try and do these things as soon as possible. I don't know if the links will stay on this, but I've put the link where this map thing is. This is on the GMC website, and there is a guide to sort of take you to this. So you have to click on registration, and then you click on registration for specialty and GP, and then it takes you to, it asks you a few questions. Have you done an internship? Have you not done an internship? And then it takes you to the correct thing of what you need to do. Then we get to, so this was meant to be a GIF, but unfortunately I had to upload a PDF version. These are the foundation schools or deaneries that I was talking about. The UK is divided into a few countries. Technically, we have Scotland, Wales, England, Northern Ireland, and that's all included in this. So these are the initial 18 regions that you rank when you've started the application process. So it's obviously for people who are not from the UK, this is quite a daunting task. So what I looked at was, so you can look at the competition ratios. This is on the foundation program website, or there's another website called Mesli, which has these really handy guides about different regions and how people's, what people's reviews are, what things are there. I chose Severn, which was quite high on the competition ratio aspect, but fortunately I got it. When I matched there, we had a induction where people from the different trusts, so like I mentioned, each foundation school or deanery is made up of multiple trusts. So that our deanery, I think, has 4 or 5 trusts within it. So we had a video presentation from each of these trusts talking about why we should rank their trust higher. So that was really helpful because, again, like I said, I was not from the UK. I'd only been here once, like 10 years ago. So that was quite helpful to see what all there was, how the people felt about it, and just to get a general vibe about it. Once you know which deanery you're ranked in, you have to rank the trust. Like I said, you have the jobs that you need to rank. So it's basically each thing that you have to rank is made up of 6 jobs. So which are the 6 rotations you'll do in the 2 years. So for example, I really wanted hematology or oncology. So these are the ones that I ranked higher up. And as a result of that, this year I'm in a town called Cheltenham. It's split between 2 sides. So I'm either in Cheltenham or Gloucester, which is just about like half an hour away. And next year I'll be in a different town called Swindon. So that's another option. Another thing some people had was they didn't know at the time of ranking what the job would be, because there are some jobs which are to be scheduled or whatever, and you don't know when you're ranking, which obviously is quite scary. And I know some people who got those jobs and they've been fine with what they got, but it can obviously be scary when you don't know the place, then you don't even know what rotation you're doing. I think we had about 300, 400 options. I only ranked 100, but I wouldn't suggest that because I was talking to people and they got much lower choices than I got, and I didn't realize it could be that bad. So rank everything if you want. How I chose to rank these things was I, like an old person, printed the entire list and I scored certain specialities either a plus 1, 2, 3 or a minus 1, 2, 3, depending on whether I liked it or not. And then I just gave them a score on the basis of that and ranked it. But I'm a terrible procrastinator and I did this the night before the deadline. So again, do as I say, not as I did. One really great resource is Reddit. I think that's amazing. That's where I found this. Again, there's a link embedded and I hope you can get that. Otherwise, I'll make a sort of another page which has all the links. Someone made this and it's a Google map. So it's a interactive thing within each deanery where each of the hospitals are. So that gives you an idea. Like I said, where I am, I'm split between 2 sites. Fortunately, there's a hospital shuttle, so I don't really have to drive or pay for transport to go from one hospital to another, and the bus leaves from right outside where I live. But obviously, if in certain places, I believe in Wales, it's the worst. So you might have one rotation in one place and another one an hour away. So in those places, it's really important to get a car. I don't have a car at the moment. I haven't even bothered with the license. That's another thing. Public transport here is terrible compared to Poland, so be prepared for that. Poland has fantastic public transport because in Gdansk we had trams, buses, and trains. Over here, they have buses only in this town, and even then, it's not very connected. I think London is probably the best in terms of connectivity. Another thing is, once you've matched to a trust, then they'll send you a contract. So keep an eye out for all those things. There are some fifth years on here, so I'm assuming you're either applying for this and there's some sixth years, so you might be in the process at the moment. Another thing for me was we're meant to get an occupational health checkup. So I didn't realize that I should have planned that sooner than I got here, because you can't work until you're cleared off by them, which is basically just a blood test to see you don't have any communicable diseases. So plan everything in advance. Don't leave it for the last moment. Then now that you have gotten everything, you need to get a visa to go to the UK. This is a great website, gov.uk, not just for visas. It's even useful for citizens. It's got quite literally everything. Whether you want to get a driving license, you want to know some rental stuff, it's got everything. So this is the kind of visa that you would apply for coming into the UK, which is called the healthcare worker visa. There's been quite a lot of brouhaha recently about the sort of salary thresholds for getting a skilled worker visa. But healthcare workers, because it's a shortage of healthcare workers, this visa is exempt from any kind of such monetary thresholds. So when I was applying, I needed a bank statement which showed, I can't remember, but the website will have a sort of amount that you're meant to have. And I think everybody I know, sort of, not everybody, but a lot of us had some issues with this. So I used my Polish bank statement, and the money has to be in your account for about 30 days. And then they emailed me saying that, oh, it wasn't meeting all the criteria. So then I sent them my Indian and Polish one, and then it was fine. Sponsor evidence. So once you match to a trust, you get what's called a certificate of sponsorship from Health Education England, which is the body that sponsors all of our visas, if we're in the foundation program. I'll come back to that later. So you get the certificate of sponsorship, the application form. This is all through a terrible website called VFS. I don't know if anyone has had experience with VFS before, but it wasn't so bad in Warsaw, honestly. And yeah, you'll have to go to Warsaw, obviously, for that. This also, don't leave till too late. And what else? I'm just seeing what else I've written down. Okay, so the PCC is the police clearance certificate. To get the Indian one, I had to go to the embassy, and that also took some time. Fortunately for me, it wasn't that long, but I know some people, I live in Delhi, so for me, I think it took a week. I know some people where it took 2 to 3 weeks for them. Also, obviously, this has to be in English. The Polish one, for example, unless you're a Polish citizen, they don't give you a translation. For some reason, if you're a Polish citizen, they'll translate it into English and give it to you, but not if you're not a citizen. So you need to find someone who's what's it called? Translator, but it has to be like on a certain list. So they have to be a certified translator. And that's also, I think for us, it was, I want to say 60 zloty for one page. A scan of your passport, a scan of your IELTS. The visa IELTS threshold is lower than the NHS one. So if you've gotten the score that you need for your foundation program, you should be fine with the visa. Your Polish TR, or I was in the middle of applying for one, so I uploaded my old TR and I uploaded a picture of my application. I think that was just the stamp on my passport. And any other visa you've gotten, I want to say in the last 5 years, it could be last 10 years, I can't remember. And this is all uploaded on the VFS website. So you start the process online, then you need to pick a date to sort of go to Warsaw and give your biometrics. They take your picture, fingerprints and things like that. I think I started this in June and I got my visa within 3 weeks or 2 or 3 weeks, something like that. It's not very, then there is an option to pay for priority, but that's really expensive. And now that, oh, another thing I forgot. So your visa will only be valid for, I got it in July. Mine was valid till October. When you come to the UK, you need to pick up your BRP, which is your British Residence Permit. So because you're joining the 2-year foundation program, your visa is linked to the job that you currently hold. So my visa is only valid for this 2 years. If I want to stay on, I need to find a job before finishing my second year and get a certificate of sponsorship on the basis of that. currently they're switching the BRP system as well. So mine's only like the physical one is valid till December this year, and then it switches to an app or something. So again, keep an eye out for what things are changing when it's your turn to do this. Then once you're in the UK, what to do? Again, join the WhatsApp groups. There's a lot of groups for your region and your trust. So we had housing WhatsApps, there were Facebook ones, all of these. Join them so that you know what's happening, you know who to ask questions. It's really scary. Obviously, you've already moved to a different country for med school, but to come to another one to work in was quite scary. And even though it's all English speaking, so that's one massive factor that's reduced, but still. So I think gov.uk also has good guides for these. I don't know what guide I've put over here for renting. These are different websites. So when I first got here, that's another thing to factor into when you're ranking jobs. The place I've picked, the closest international airport I have for outside of Europe is London. So I have to go about 2.5 hours. When I was coming from Gdansk, I managed to come from a town called Bristol, which is only about an hour away. So if you plan to travel home quite a lot, which I'm still doing, but I need to go all the way to London every time I need to travel. So that's another thing to keep in mind. Renting. So I initially moved into hospital accommodation, which you have to pay for still, but you can rent for a short amount of time. There are some long-term ones available, but they're usually already occupied, and there's waiting list for that. So I think unless you start the conversation with your trust really early. So it's run by third parties, but linked to the trust. So for me over here, it was really close to the hospital, and I stayed there from July to about September because I was really picky with finding a place because I wanted to find a decent place. So some things you need to consider over here when renting. For example, your gas and electricity bill is separate, could be included. There's something called council tax, which is also quite hefty. So some places included in the rent, some places don't. I had a really strange person who was trying to tell me that she wouldn't have a proper formal contract and would all just be on the basis of WhatsApp. Don't do things like that. It might be a little complicated to find a place to rent while you're still in Poland. I didn't want to do that, but I know some people who did, who found people over the WhatsApp chats and just sort of moved in with them in different places. So some landlords, for example, would want references from previous landlords, or they want you to have a UK bank account and show them the bank statement. So obviously, if you're moving from Poland, that might be really hard. My landlord didn't want anything like that, so it was fine for me. Register with a GP. So a GP is a general practitioner. So that over here, you have access to healthcare like everybody else. There's no sort of restrictions on that. Not sure how it's in Poland. In Poland, I paid for private insurance. Here, you can have private insurance, but you can pay. You can just go to an NHS GP, but you need to be registered. So there's, I think, an NHS website which has really easy form to fill. It doesn't take long, and then you get a letter from them. Bank account. So I started with, and everybody I know has a Monzo account, which is not a brick and mortar bank. It's an online bank, but it's really useful. So I quite liked it. I'm not sponsored by them or anything, so do your own research into what best suits you. But I thought it was quite easy. And I now have another account as well, but I primarily use my Monzo. If you're coming here and you want a referral code, reach out to me. MDU is what is the Medical Defense Union. So this sort of covers you from the medical legal aspect of things. It's quite a nominal fee. I think it's £10 a year. I don't know if that's only because I've just started, and I'm pretty sure later on it'll get higher. And they have a sort of helpline. So if there's anything that's happened, you think you might have made a mistake, or what's it called? And a complaint's been raised against you or anything. Touch wood, nothing that's happened is yet. But you can reach out to them and they'll sort of be your defense team. The BMA is the British Medical Association, which is a union of for doctors. There's another one, but I can't remember what that's called, but BMA is the most common one that people join. I've also joined the BMA, and they're also sort of, if you have any disputes, they have your back. Another thing is when we get our schedule, it's meant to comply with certain rules. So they have a checker on there where you just fill details and it does the maths for you and sees if your schedule is compliant or not with what the rules are. They also are responsible for sort of negotiating with the government in terms of our salary and benefits and things like that. So I would recommend joining them. I pay about £10 a month for this, but I joined them in August. Some people who joined them in October as international graduates they had a sort of scheme at that time where it was free for a year. So I missed out on that. Now, once you've made it to the UK, working as an F1, I'm just going to go over it a little bit to give you an idea of how it is over here. We had a really good trust induction. My trust is really sort of on it with all these things. So I was quite fortunate that way. I think we had about 4 days or 3 days, and you get paid for this. So our induction had an introduction to different sort of teams that we have in the hospital. For example, we have something called acute care response team, which is a group of nurse practitioners. So if you're with a deteriorating patient, they're just another group who comes to lend a hand. We had introduction from the radiology team. We had microbiologists speak to us. We had a few sim sessions just to sort of get us used to practicing. So over here, when you put out a crash call, you have to dial 2222 and then say where you are on the system, and then everybody who's on the team that day gets a sort of message on their device, which is, we carry a sort of pager. It's a little ancient, but yeah, which tells you where you are and things like that. So just to get us used to the trust policies for all these things. So that was really, really helpful. And then, like I mentioned, you do 4-month rotations. So you have 3 rotations as an F1 and 3 rotations as an F2. This is based on your rankings and what you get. So, for example, I started on geriatrics, which I thought was a really great one to start on because it's sort of slow enough that you find your footing. And I was, like I said, I'm split between 2 sites. I was in the smaller hospital for this. So I thought that was really good because, yes, you have a lot of responsibility, but it's easier to handle sort of 4 wards versus doing 6 wards of people who are really always unwell. So that's what an on-call is. So an on-call basically is your normal working day. So when I was in geriatrics, I was saying my rotations. I started on geriatrics, then I had vascular surgery. So vascular surgery at our hospital, because we're not a tertiary center, we're what's called a DGH, which is a district general hospital, does not have vascular surgery out of hours. So vascular surgery is only from 8 to 5 o'clock and then not on the weekends. So as a F1 in vascular surgery, you do on-calls with general surgery. And then right now I'm in ED. As a F1 in ED, you're what's known as supernumerary. So you're just extra. You don't do any on-calls. You don't do any nights. Then next year, when I'm in a different city, I start on GP. Then I have colorectal surgery. And then I finally have hematology. So what's working on call? When you have a normal working day in medicine, that's 9 to 5. And in surgery, it's 8 to 5. So you have a basic team, 4 to 5 people at your grade, 9 to 5. And then after 5 o'clock to 9 o'clock in medicine and till 8 o'clock on surgery, it's just you. And not just you, as in like, or you're the first port of call. So the team in, let's say, surgery is you as an F1. You have what's called an SHO. So that could be anybody who's either an F2 or slightly higher. You have what's called a registrar, and then you would have a consultant on call. There's another slide where I'm going to go through all the grades because that was also quite confusing when I got here. So the nurses basically ring you first if somebody is unwell. So that can be something as simple as just writing up fluids for somebody who, for example, is nil by mouth. So if they're about to go for surgery the next morning and they can't eat anything or drink anything, so you have to ensure they're getting hydrated with IV fluids. Or it could be like someone has a new oxygen requirement, someone's spiking a temperature, things like that. So they call you first. And like I mentioned, we have a sort of pager system at our hospital. Some hospitals have moved on to apps and things on the phone. We don't have that over here. Fortunately, our system of documenting is online. Some hospitals are still on paper. So that's another thing that you can check if you want to prior to ranking your hospitals. But I didn't look into all these things that much because in Poland, you don't really work as a doctor in your 5th, 6th year if you don't speak the language. So I was fine with just getting the rotations I wanted, and I was sort of thought I could just deal with the rest. And so far, it's been fine. So that's working on calls. So you can obviously escalate to a senior if you feel out of your depth. And there's no shame in saying you don't know how to handle something. It's obviously way better to ask for help when you need it versus not asking for help and risking a patient's life. So yeah, always reach out for help if you need it, and people appreciate it if you don't sort of delay that. There are obviously some skills that, again, in Poland, I didn't get to practice much. Like I'd only done 2 ABGs, which is an arterial blood gas in med school. So I wasn't very well versed with that. Now I've done quite a lot on my own call, so I feel fine with them. We don't do cannulas and bloods in Poland because that's all nurses. But over here, it's largely doctors. There are some nurses who can do it. But sometimes you can be on a ward and a nurse says that she doesn't know how to do it, or she doesn't have she's not signed off to do it. So it could be you. And if they fail, then it's sort of you're the next step. So you have to do the difficult ones. So it's, again, something that you get with practice. I feel more confident now. So when I started, it was quite daunting because I'd only done a cannula in a workshop when we did it in med school. So that's something they taught us in induction as well. And for example, taking blood cultures, they have different sort of procedures here. So you go through all that in induction. And always reach out for help if you don't know anything. It's better than goofing up and then getting into trouble. Working nights. So again, nights are usually on medicine. It's 9 p.m. to 9 a.m. and surgery is 8 p.m. to 8 a.m., which can be quite tiring because in medicine, I think the maximum number of nights I had in a row was 3. But in surgery, I had like 4 nights, a few days off, and then nights again. So that's really, really tiring. But again, it's doable. You get used to it. It's nothing that you can't handle. You've moved to a different country, gone through med school. You can do this. Again, it's the same system. Nurses call you nights. They might call you for fluids, but that's quite annoying if they're calling you at night for fluids. Usually it's someone who's unwell or someone who's getting worse. And then, like I mentioned, you can escalate to a senior if you don't feel fine with what's happening. You also sort of get used to dealing with these things, and you recognize better when to escalate and how to deal with stuff. So don't worry about it if initially you feel a little out of depth. Then this is an exam that we need to give when we're in F1, but UK grads give this in their final year. So at there's no hard and fast rule about if you can prescribe before this or not. Where I started in geriatrics, my consultant, which is the senior doctor, was fine with me prescribing prior to having given this. I think we gave it in December, but I'm not sure. I can't remember what month we gave it in. I think it was December. This is it's graded on a curve, so it depends on how everyone's done. Then it gives you a pass mark. I think it's usually around the 60s. So there's different sections of this. So this is just an example that I've put of one kind of question where it would be writing a prescription for this patient based on the description. Other examples are finding a mistake in certain prescriptions, and then there's some calculations of doses and things like that. But this is a sort of open exam because you have access to the BNF. I'm hoping pharmacology have told you about BNF. It's the British National Formulary. It's an online website and a book where you can look up doses, indications, contraindications, side effects, things like that. There's multiple sample exams on this website. So your trust will sign you up for this when the time comes, and then you can access the sample papers. Again, I'm a procrastinator. I studied for this quite literally the night before and I was fine. So don't worry about it. It's not that hard. There's a YouTube series by a resource that I'll mention later, which is brilliant. And I just did that essentially and I was fine. Then other things to keep in mind. This was a juggling GIF. Now it's just weird. There's something called ePortfolio. Again, that's something that you won't know because you haven't dealt with. But over here, they go through it in med school. So they're quite used to it. It's essentially an online sort of portfolio. So there are different things that you have to fulfill in your F1 year. I've sort of printed out to go through it because now I need to make sure I've done everything. There's a couple of things that you have to make sure. So one example is things that you have to do. I can't remember what it stands for. It's called SLEs. So it's practical skills that you've done. So it can be, for example, I did a nerve block for somebody, so I've done that. I did suture, so I've put that up. And then a senior who's seen you do this has to give you feedback. You can also have case-based discussions. So if you've sort of had a complicated patient, you can discuss it with the senior and then write up about that. Another example is somebody sort of watching you talk to a patient and interact with them and come up with what's wrong, like a differential and plan like that. That's also another thing you would have to write about. Then you have to do something, for example, that's called a TAB, which is a team assessment of behavior. So I did it in my first rotation, and you have to have people from here they really focus on MDT, which is multidisciplinary team. So you have to have people from not just doctors, even other aspects of healthcare, sort of write about how you are, if you're a team player and things like that, if there are any concerns about you. So I had physiotherapists, I had nurses, I had someone who's like a receptionist in the ward, things like that. And all those people had to write about how I was. And then there's another one called Professional something, PSG. I can't remember what it stands for. That's a sort of similar thing in terms of feedback on you, but that's based on your professional feedback, so your clinical skills and things like that. Now, it's a little daunting, but there's lots of resources on YouTube, and there's all these things that I've printed out. It's all off of the foundation program website, or I can't remember what it was, but if you look up all these things, you'll find it. It's not. Horus is just the website. Then locum shifts. So you have your basic schedule that you get, which is what you're meant to do from the hospital. And then on your off days, you can pick up extra shifts, which are called locums, and you're the locum in that scenario. These are paid better than you would usually be paid because you're filling in gaps that otherwise would be unfilled, and it would be a safety issue. For our trust, we have an app. It's not just solely our trust. It's an app that our trust also uses, where they just put up shifts that are unfilled, and they put up a price. Sometimes if it's really close to the day, they increase the price. Other trusts follow different things. I know someone else trust emails them or something about different gaps. But yeah, it depends on your trust. Obviously, this also you have to take into account how tired you are. Don't do it just for the money. Teaching every 2 weeks in F1 and F2, you have sort of not mandatory, but you have to meet a certain amount for your portfolio. You have to have 30 hours of teaching. So it's really helpful. Usually we have different topics. So like 2 weeks ago, we had a talk on Parkinson's disease. Before that, we've had something on nutrition in unwell patients, because how important that is for not just anybody who's healthy, but even more so when someone's sick. We've had stuff on blood cultures and the best method to do it. Make sure you're not making mistakes. We've had one on diabetes. We had one on fraud for some reason. But yeah, self-development time. So in each rotation, you get 34 hours of self-development time, which are meant to be time that you spend on your ePortfolio. Depends on your rotation. So in my first rotation, I could only take like half a day or something every month or something like that, or every week. And in my surgery rotation, and the one that I'm currently on, I could take 1 day off. I think it was a total of 4 days. Then you get 5 study leave days in F1, and I think it's 10 or 20 in F2. So you can only take these for very specific scenarios. So for example, I've taken 2 days off this week because I'm doing an ALS course, which is also a mandatory requirement. It doesn't count that, because in med school we had it in emergency medicine, but because it wasn't a certified course, I'm technically not ALS certified over here. So in order to complete F1, you have to have at least an ILS certificate or an ALS certificate. You can also use study leave for what I've mentioned further down. It's taster days. So if there's any specialty that you're interested in, your trust should email you people to contact for that, and you can sort of get a glimpse at what the normal day is for people in that specialty. You can talk to them about how it is and how they got into that specialty, any advice they have for you. That's also a good way to sort of get into projects with them. Then annual leave. So that's basically the days off that you can take apart from your normal days off that you get, like a Saturday, Sunday, or if you work some days, you get a few days off. So annual leave is 9 days per rotation. I have a few pictures of my rota, so I'll talk about that more then. So these are 9 days that you can only take off on normal days. So like I mentioned, on calls and nights, You can't take annual leave on those days. If you want to go somewhere on those days, you need to swap with somebody else to make sure that there's no gap in the rota. Then types of shifts. So this is an example of, oops, I have gone too far. Yeah, this is an example of one of my easy months in my medical shift. So the blue is the days I took off. So because I had normal days, I could take those days off. The ones in red are the on-call ones. So on-call shifts are always 12 and a half hours. The half hour is sort of for you to hand over to the team that's coming in. So 9 to 9:30 is a normal medicine on-call. So that's how it was for us. So you would work 2 days, get 2 days off, and then have 3 days. It is really tiring, but again, depending on the day, it can be fine. And some days it's just like you want to cry and just quit. Not quit, but yeah, stay. So this is a basic shift pattern. This is just to sort of show you other shifts that we have. So like I mentioned, nights. So it's 9 p.m. to 9 a.m., 9:30 a.m. if you're in medicine. Then this is something called, I don't know why they pronounce it as clerking, even though you write it as clerking. But this is basically when you, as a medicine F1 or F2, medicine junior doctor, go into the emergency department. So if someone has been declared by the emergency department as someone needing admission, they go through medicine or surgery. So a clerking document is something that you open. So it when someone is being admitted. So it's an online, not online, but like it's online. It's on the computer. So you write history of like you go through med school history. So history of presenting complaint, past medical history. You come up with a differential set of diagnoses. You start basic amount of treatment, request scans and things like that. And then you go through this. You've done this, you start the treatment and things like that. And then you discuss the patient and do what's called a post-take. So take is when someone is being admitted. And this is a post-take round that you do with a consultant who's a senior doctor, like a specialist. And they go over your plan and they examine the patient as well. And then they decide if they want to add on something and things like that. Ward cover I've already mentioned. Then this was an example of a shift pattern in surgery, for example. So surgery was a little more hectic than medicine, but then you get paid more as well because you're doing more of these out of hour shifts. So yeah, this was the worst, the nights one, where you have 2 nights. I had 2 nights actually. It was meant to be 4 because that's when I switched rotation. So normally it would be 4 nights, 4 days off, 2 normal days, and then nights again. And that's on calls. Okay. And this is what I have in ED. So as I mentioned, in ED, I'm supernumerary. So I don't have any nights and I don't work longer than 9 o'clock. ED has a slightly weird sort of shift pattern because I have some days where I'm working 11 to 7. Then all of last week, Tuesday through Sunday, like this also has, I worked from 1 o'clock in the afternoon to 9 o'clock in the afternoon, which is nice because you're waking up late, but it's also really tiring because you're finishing at 9 every day and that's not fun. Then ARCP. So every year you have what's called an annual review of competence progression. So like I mentioned, you have this online portfolio. So someone will judge your portfolio and make sure that you're meeting all the targets that you're meant to meet. And this doesn't stop until you've become a specialist. You have this every year. You have portfolio requirements every year. So that's something you just have to get through. Specialty training in the UK. So there's a few types of trainings here. I've just copied this off of different trust website. You have either run-through training, which means that you give one application at the start of it and you're in the specialty training program until the end. And then you have uncoupled, where you have to go through multiple levels of applying. So like this mentions core surgical training and emergency medicine. So for example, in surgery, you have 2 years where you work after, you can get into it right after F2, but obviously this is dependent on the competition ratios, how good your application is and things like that. What's happening nowadays, because it's the number of people applying is increasing so much, people often have to do F3 and F4, which is just like an informal way of saying they've finished the 2 years of the foundation program, but haven't gotten into specialty training, or some people don't know what they want to do, so they do that. However, if you're on a visa, it's a little more complicated because you can't just randomly take shifts here and there. You need to have a proper job in order to have a certificate of sponsorship and a visa. So then you can apply for what's called a trust grade job. like I was mentioning the visa thing. So you have to be employed by a specific trust in order to get a visa. So it's becoming really hard to get even those jobs because the number of applicants is sky high. So even for a few vacancies, they have like a couple of hundred people applying for it. This year, for example, for internal medicine training, so for like I want to get into hematology. So how I would have to get into hematology is after I've done the 2 years, I have to get into what's the IMT, internal medicine training program, and that's for hematology. You do 2 years of internal medicine training, and then you apply further on to a heme specialization, which would be about 5-6 years. But this year, just to get into IMT, for about 1,670 posts, there were 4,400 applicants. So it is a really, really insane competition ratio. So even if your specialty overall doesn't have a very high competition ratio, if it's a medicine specialty, you have to get through IMT, which is mad. And surgery obviously is also quite competitive. Emergency medicine has very few spots, so they have slightly different specialization pathway. Anesthetics and emergency medicine starts with the same STEM, and then you split into emergency and or anesthesiology. So that's ACCS. So like this says, you do 3 years of that, and then you get into either emergency or anesthesiology. So whatever you're interested in, look it up, see how it is. Becoming a senior doctor over here can take anywhere from 10 to 12 years, if not longer, if it takes you time to get into a specialty training program. Then different words that we use over here for different grades is as the levels. So anybody who's not a specialist, regardless if you're a day out of med school or 7 or 8 years out of med school and been working that long, is considered a junior doctor. The only people who are not a junior doctor is a consultant who's a full specialist. So like this says, foundation year 1 is someone like me, FY2 is me next year. ST is specialty training, so it'll always have a number after it, like ST2, ST3, things like that. When you're ST3 and above, you're considered a registrar. So that's someone who's sort of in a training program and is senior enough to make certain decisions. So that's SPR, like this says. And by then you're in a certain specialty, so you're a registrar of that specialty. GPST is people who get into the GP training program. That's about 3 or 4 years, something like that. I'm not really sure about GP, which also is usually considered something to have a low competition ratio, but of late is also getting a crazy competition ratio. Senior house officer is sort of an old term, which isn't really used. I mean, people still use it. They still say SHO, but it doesn't really mean the same. Nowadays, anybody who's FY2 and above is called an SHO. And obviously, then the final boss is the consultant, who's a full specialist. There's also something called SAS, who are specialty doctors. So anyone who's done 4 years in a certain specialty and has a permanent job. And so when you're doing all these other trainings, like a ST4, 3, whatever, getting into different specialties, you're still rotating. You're not in one hospital doing your entire training. You have to rotate through different departments if you're in internal medicine, for example, and you have to be in different trusts and things like that. So SAS or specialty doctor is in one specific place. And there's certain sort of other pathways in the UK to become a consultant, but then I don't think they're recognized by other countries. So there's something called CESR. So you can do that for internal medicine as well, where you get a job as a trust grade or something like that, and you tick off these competencies that I mentioned. So you have to be able to do certain things. Or in surgery, for example, you have to do X number of specific procedures. So like if you have to do, let's say you're a general surgeon, you have to have done X number of cholecystectomies or things like that in order to be competent. Then resources that we have. This is a fabulous website called Mind the Bleep, which has everything you can think of that you need. So they have something as basic as fluid prescribing. They have how to deal with on-calls. If you know what rotations you're doing, they have people who've worked those rotations, write about the most common presentations that patients have, how to deal with them, how the job normally looks like. Another thing I forgot to mention earlier was you should also look up the websites of your foundation school. So the deanery. So like our deanery, I'm in Severn, has a really good website. It looks really ancient, but it has a lot of information. So like I knew the jobs I was doing. I was able to look up what a normal day looks like in that job and what is expected of me as an F1 in that job. So Mind the Bleep also has things like that. And the exam that I mentioned, PSA, they have about a 7-hour sort of video series. It's also on YouTube, which I thought was fabulous for the PSA, and essentially is why I passed it despite studying for a day. They have specialty specific presentations. So they have radiology, they'll have different images from that and different conditions and how they would appear in that. Cardiology, different conditions, what to do in those scenarios and how to deal with it. They also have a lot of WhatsApp groups. So they have one for example, IMGs. They have different ones for specialty training. So they have an IMT one. They have random things like a finance one where people talk about stocks and shares, which I haven't really gotten into, but things like that. You can find all this on their website. It's literally just called Mind the Bleep. Then there's another one called Medics Money, which I haven't really used much as yet, but it's someone who was a chartered accountant and is now a doctor, and somebody else who's a GP. So with money related financial things specific to doctors. So like our tax issues and our pension and our payslip and things like that, how to save. And it's a great, I mean, I need to go through it better. They have a podcast as well, but I prefer to read stuff. Then BMJ Best Practice is a sort of website which is similar to Up to Date, but way more concise. It's closer to Medscape, I would say, in terms of how it describes conditions, and it has an app as well. So it has a summary, it has risk factors for a disease, what the typical presentation would be, first investigations to order, other investigations to order, management, treatment algorithms, and things like that. Geeky Medics is also a really good website, which is largely for med students here. But I found it really helpful. For example, if I'm going to do a procedure, they have, because they have a lot of OSCEs over here. When I was at GoMed, IR was the first year that had OSCEs in the 6th year. So we didn't really have a lot of practice with that. So for example, when I was going to go put a catheter in somebody, I quickly pulled up the website, which it just has all the steps to go through. I think they have a few other things, but that's what I tend to use them for. So anything that you're going to do, suturing, blocks, stuff like that, it's really great. And it's really good even for on-calls. They have all sorts of scenarios that you could come across and how to deal with them. Then some sort of negatives or things that might cause people pause before coming here, or issues that they have right now. So as an FY1, I currently get paid £15 an hour as my base pay. Then if I work weekends, I get paid slightly more. Nights are paid more. And on calls also, I think, slightly more. But overall, it's a pretty shit pay, and it's been worsening over the years in terms of whole numbers. So our union, like I mentioned, the BMA, is currently in talk with the government to improve our pay. And as a result, we've also had days where we've gone on strike. So you just don't go into work. So that's stuff you need to think about. Are you prepared to do it? Are you happy with how much the pay is? It's livable, but it's not great. Then another sort of sore spot these days are allied healthcare practitioners. In the UK, they have something called physicians associates. It's basically people who've done a bachelor's in essentially anything, then do a 2-year master's degree and can work at an hospital. In the ED, we have a lot of them. They can't prescribe as yet. Apparently from next year, they're likely to be able to prescribe. So the issue is that they don't tend to rotate. So they get good at, for example, doing procedures in a specific specialty. And then oftentimes you're just rotating. So the senior doctors don't want to bother teaching you things. And they'd rather the PA who's been there forever and is going to stay there forever knows how to do it and just does it, so they don't have to bother. So things like that are a little not so nice. Another thing is, like I mentioned, the competition ratio. There's a massive bottleneck in most specialties. So like in my year, there were 9,000 people who joined the foundation program. That includes UK grads and IMGs. But they don't increase the number of spots that exist, like the training posts. So it is obviously really hard to get into any specialty. And that sort of leaves people in a limbo. Like I know people who are 5 years, 6 years post graduation, and they're just sort of floating and doing regular jobs. But I also know people who've come from other countries, worked here for 1 or 2 years, and then managed to get into a specialty training program. You sort of just have to, and I didn't put up much about how to apply to that because that's constantly changing. Like for next year when I'll be applying, there's certain things that could have given me points. Like I led a few societies and organizations in med school, and that would have given me points, but that no longer gives me points. So my advice would be, I wish I had done more sort of conference related things and publications in med school, which I was kind of shy about and I didn't really do. I only did one, I joined one conference to give a presentation in my 6th year. And that's because I had started a scientific circle in my 6th year. So I did it through that. And I knew I was only interested in oncology and hematology, and there wasn't an oncology circle. And I started the English division hematology one way too late. I should have done that sooner. So if you're interested in a specialty, most doctors are receptive. Find someone who's interested in doing it. Start the organization. If it doesn't exist, it'll carry on after you as well. And obviously publications are really hard. Plus the fact that it's a different language always makes it harder to get your foot in the door. But try. I wish I'd done some publication or something and more. So the fact that I gave an oral presentation, and technically it was an international conference because we had people from other countries as well, that gives me a few more points. But if I had publications, that would have also given me more points. Things like having a postgraduate degree gives you points, but not many people tend to have postgraduate degrees. There isn't really much of a value in them as a doctor over here. So all these things. And now I will be taking any questions that you have. You can also feel free to email me. If you're coming to the UK, you want some advice, help, anything like that, feel free to reach out. If you're still an existing student and you have any questions, feel free to email me.
So thank you so much for helping all the students
No worries.
who are waiting to go to UK. Thank you so much for attending, and thank you so much for helping us.
Please tell us what you liked or disliked about the video and ask any questions in the comments. If this video is useful, please give it a like. All links discussed in the video can be found in the description, and please use those links and subscribe to the channel to support us so we can keep producing content. Thank you, and maybe watch another video.